Let's start with the basics. Urinary tract infections, or UTIs, are a problem affecting the urinary system, including the bladder, urethra, and sometimes even the kidneys. These are bacterial infections that can cause a range of unpleasant symptoms. Did you know that, according to research, UTIs are among the most common bacterial infections, affecting millions of people worldwide every year? This highlights how important it is for all of us to be aware of this threat. And what are the symptoms of urinary tract infections? The most characteristic include frequent and painful urination, burning during urination, and a constant need to use the toilet, even when the bladder is empty. Disturbing, right? That's why it's so important not to ignore these signals and to react quickly, preferably by consulting a doctor. And this is where self-tests come in. But what are they? Self-tests are easy-to-use home tests that can help detect urinary tract infections. There are various types of these tests available, and their selection can depend on a number of factors. Thanks to them, a preliminary diagnosis is possible from the comfort of your home, which is a huge convenience. Interpreting the results of the test is simple, and a positive result is a signal to immediately contact a doctor. However, remember that self-tests serve as a support tool and do not replace professional medical opinion. When it comes to treating UTIs, treatment most commonly involves antibiotic therapy. It is important to strictly adhere to the doctor's recommendations because improper treatment can lead to complications. Additionally, consuming a lot of fluids and maintaining proper hygiene can aid the treatment process. Let's listen to what specialists have to say about this.
I have a health alert today about urinary tract infections on the rise and resistance to antibiotics.
Our chief health editor, Dr. Partha Nandi, has some good advice for people coping with this problem.
As antibiotic resistance continues to be a threat to global health, another common infection is becoming harder to treat, and that's urinary tract infections. Now, urinary tract infections are so common that 1 in 2 women will have at least one in their lifetime, and many end up with repeat infections as well. Men also get them, but not as often. Now, typically, UTIs are treated with 2 common antibiotics, Bactrim or ciprofloxacin, but growing evidence shows that UTIs are becoming more resistant to these medications, and this is extremely concerning. Now, anyone who has experienced a UTI knows how painful and annoying it can be. Typically, you'll feel the urge to urinate a lot and feel a burning pain when doing so. Now, the scary thing about UTIs becoming antibiotic resistant is that if they're not treated, you can end up with a kidney infection or permanent kidney damage. Women can have premature babies, men can have urethral narrowing, and UTIs in both sexes can potentially lead to sepsis, which can kill if not treated. So what can be done? First of all, please don't ask your doctor for antibiotics when you have a cold or the flu. They don't work for viral illnesses. Secondly, do ask your doctor if there are other alternatives you could take first instead of antibiotics. Thirdly, to help avoid UTIs, be sure to empty your bladder completely, and remember that hygiene is critically important. And lastly, importantly, keep hydrated. Drinking lots of water helps dilute your urine. For 7 Action News, I'm Dr. Partha Nandi.
All right, Dr. Nandi, thank you.
In summary, urinary tract infections are a serious problem that requires our attention. Early detection and proper treatment are key to health and well-being. Self-tests can play an important role here, allowing for a quick response and monitoring of health status. Remember, always consult a doctor at the first symptoms and responsibly use available tools, such as self-tests. Thank you for watching. If you have any experiences or questions about UTIs, leave a comment below. Don't forget to subscribe to our channel and give a thumbs up if the video was helpful for you. See you in the next episode.